everyone. I'm Josiah Whitman, CEO of Whitman Partners, the search firm for directors of surgical services, your search firm. Today we have Pat Sales with us, a legend of perioperative services who has focused her career on both hospitals and ASCs. Pat understands that a successful run surgical services department has a strong financial background. That's why her talk is titled, Why the Chargemaster Controls Your OR Revenue. Let's dive in. Pat, where would you like to begin?
Well, first of all, thank you, Josiah, for the introduction, and thank you for allowing me to really talk about a subject that a lot of new directors, especially, but even some seasoned directors are not real familiar with what goes behind the Chargemaster. The Chargemaster is the backbone of the healthcare revenue cycle. Doesn't matter if you're in the OR, if you're in any other department, that's where all of the charges are held for that facility. What this does is it helps shape pricing, impacts reimbursement, and it also has a compliance aspect to it because we want to make sure that we're doing compliant billing, excuse me. It's sometimes called the CDM, which just stands for Charge Master or Charge Description Master. And like I said, it's very unfamiliar or misunderstood many times by directors and clinical staff, but it's very essential for leaders to understand what goes into the charge master and the importance of it. So I'd like to just dive into what is the charge master. It looks like just a big spreadsheet to most people that look at it, but it's a comprehensive dictionary that contains all procedures, supplies that are billable, your pharmaceuticals, or any of your diagnostics that are billable items. So obviously some of this impacts other departments other than the operating room. Let's talk about the components of it. First of all, it has your charge code, which that is developed by your facility. That can be an alphanumeric, a numeric identifier for that specific charge. And we have the CPT and the HCPCS codes that these are crucial. These are developed by the AMA. The CPT is usually the procedure itself. The HCPCS codes are a lot of times your implants or billable supplies that, because some of these CPT codes require a supply or an implant in order for them to pay for the service. Includes the revenue code. This classifies the service. So let me just give you an example. 360 would be the code for your main surgery. 370 would be your anesthesia billing, and those have to accompany that code in order for them to pay, and they have to be correct. It includes the description. The description can be a short form, kind of an in between, or it can be the actual long form that the AMA gives. Usually people use either the modified medium length one or the short length. Then the price. This is based on we call the APC rate for outpatient billing. I'm not going to talk about inpatient billing with the Chargemaster because that is a whole different type of billing, and that's with the DRGs. But the APC rate is determined by CMS, and facilities usually charge a percentage above that in order to bill out, and it also helps in their cost reporting at the end of the year. You always want to make sure that any of your charges in the Chargemaster are above what CMS says or Medicare says that we can bill for. You don't want to be undercharging. That's lost revenue. And then it has coding and compliance. So certain codes cannot be billed together, or they may require a modifier. So that modifier has to be in that build in order for that to drop, or sometimes coding adds that on the back end. Let's talk about the purpose of the Chargemaster. Obviously, the main purpose is for us to have the charge in there so that we make sure that we're capturing the revenue, but it also ensures consistent and compliant billing. And this is a big area that has just continued to evolve. It has a financial impact. If you have an incorrect or an outdated charge, this can lead to denials, or you can get underpayments because you haven't updated the increase that came out, which leads to lost revenue, and you can have compliance violations from this. Let's talk about the compliance impact. CPT HCPCS code changes, the main ones come out and take effect every January. They can sometimes say, well, we're not going to put this into effect until maybe February. But then we also have quarterly updates, and those are important to be aware of also. There are a lot of third-party payers that you can use, or not payers, excuse me. There are a lot of third-party vendors that you can utilize that can hold your Chargemaster, and also has all of the Medicare, the CPT HCPCS codes and everything. Make sure that you have your annual updates. Look at the OPPS fee or the APC rate that they are saying that Medicare will reimburse, and that's part of the Medicare guidelines. And also some states have very specific, especially for Medicaid, billing rules that impact this. So you need to be aware of all of this, working with your Chargemaster team. The operational impact is it links the clinical workflows to the revenue cycle functions. Breakdowns can occur when the clinical staff adds a new procedure without notifying the CDM team, because then everyone's scrambling on the back end trying to figure out how to charge for this, which delays billing, delays revenue, and it can lead to denials. And it can generate also mismatches that generate billing errors downstream, and you want to prevent that as much as possible, because a denial can delay your reimbursement. I've seen it happen where it takes over a year sometimes to work through the denial with payers. And so it's very important that you capture that revenue. Has a patient impact. With price transparency that came out in the early 2020s, we're supposed to post our Chargemaster in a readable format that any patient can go online and pull up our Chargemaster and see, oh, this is how much they charge for this. Granted, a lot of patients don't understand the medical terminology, but it is required that we do that, or hospitals are facing fines for that. And you want to really promote a positive public image and perception and trust with your patients and your customers. The other thing that the Chargemaster does is it prevents revenue leakage. You may think that you have everything in there, and let me just give you an example. You might have a very high price supply that's billable, but it doesn't have if you're using charge stickers or however you charge for that, and your staff can sometimes say, wow, is this something that we need to be charging for? And I've seen where we had $1,000 supply that didn't have a charge sticker on it. That was just revenue flying out the door. So it's important to be aware of those things. Let's talk a little bit about Chargemaster development and maintenance. First of all, who should have input? Obviously, you as the clinical director should definitely have input into that. It's also important that your staff, you may have a staff member that's very attuned to the financial part of it. And it's important to have their eyes on some of those things so that you're not losing some of the revenue that you could get. Coding needs to be a part of it, because obviously they're going to be the ones coding it, whether it's on the back end or the codes attached. Usually I've seen it where they code based on the op report at the end of the procedure. Finance, your revenue cycle director or your CFO, whichever your facility utilizes, should be involved in that. Compliance, to make sure that you're compliantly billing and developing these. And whoever's doing your build, whether it's IT or if you have an EMR clinical staff that specializes in that. Maintenance includes, like I said, your annual updates and your quarterly updates. So there's ongoing maintenance. The Chargemaster isn't a piece of paper that you look at once a year and make sure everything's okay. The Chargemaster is something that changes throughout the year, and it's important to make sure that you're keeping track of that. Also, you're looking at best practice. Are we billing, and are we doing things that really would be all of our regulatory bodies look at also. Common issues in Chargemaster management can lead to denials, compliance, or lost revenue. Some of the things, especially that we're seeing with denials right now, is a lot of facilities use disposable scopes and probes. Are you documenting those? Because those may be pass-through charges that they're paying for, which means that they just pay for the cost of it. And if those aren't documented in the op report and your circulator isn't documenting them in her records or his records, those can lead to denials. Anesthesia blocks, are they getting an order from the provider saying that this is a block that basically it's going to be for post-op management? And is the anesthesia provider documenting that block appropriately so that you're getting paid for it? We're also seeing implants denied if those aren't listed in the op report and then they're not documented by the circulator, then payers aren't going to pay for those, or it's going to delay it while you go through the process of making sure that those get documented. What is your responsibility as a clinical leader? One of the biggest areas that I've seen is that whenever you're adding a new service, that needs to be communicated to the CDM team, whoever's building. And you may know in September of this year that you knew that you were adding a new service starting in January. That's the time for this build to start happening, so that when that service takes up off the ground, especially if it's one that has heavy implants, everything's ready to go. So there's no hiccups in the billing part of it. And also making sure that your clinical team is aware of all of this so that they know what's happening as it comes online. Make sure your documentation supports the charge capture. If you have a clinical person that likes to review some of these things, or you know that this is an area that they would be good at, it's important to have someone doing that. I always say, put someone in positions that they have a passion for, because they're going to do a good job for you. Participate in your quarterly and annual reviews. In the beginning, when I first started working with Chargemaster, what I saw was that the OR director was absent. Well, there's no one better to know what happens in the OR than that director. So make sure that you're a voice in that, and a very strong voice. Understand your charge flow. What happens from the time that patient walks in the door, or is wheeled in the door, I should say, and then that patient is wheeled out, the charges drop, we make sure everything's there. It goes to coding, and then it goes to PFS for billing. We used to think everything stopped right there. Well, now we have denials. And so we have a denial team that comes into play to help with capturing all of those charges. So it's really encompasses a lot of different people that touch that particular record and moving forward. And make sure you're reviewing your financial reports on a regular basis. Every week, you should have a good pulse on what's happening in your facility and in your department. So in closing, I'd just like to talk about, just to highlight a few things. It all starts with a clean and well-managed Chargemaster. It's important that this be a big priority in any organization, because it is the backbone of hospital billing. And an accurate CDM prevents denials and lost revenue or delayed revenue, which we know how important that is these days. And it takes a team, as I stated earlier. You don't work in silos. Make sure that everybody's on board and everybody's on the same page as you're moving forward. Price transparency, make sure that your charges are accurate so that patients don't have surprises, or that you're able to explain. Someone on that CDM team should be able to explain to a patient if they have questions. I've had patients that have called and I've had to explain how that all works. And so you need to be familiar with that. The other thing is, and the last thing I want to just talk about, is a well-managed Chargemaster improves your operational efficiency and your financial outcomes. It really does streamline things if you have it just honed in and fine-tuned, and I can't stress that enough.
All right, that's a wrap on our deep dive on the Chargemaster with the legend Pat Sales. Pat, thank you again.
Thanks. I appreciate the opportunity.
I'm Josiah Whitman. Please share this with someone else that can benefit, and we'll see you on the next.